Free, free Palestine! Free, free Palestine!
My name is Rochelle McLaughlin. I was adjunct faculty
at San Jose State University for over 20 years. I resigned in protest over their support for the genocide and for their wrongful suspension of a renowned justice studies professor, Dr. Sang Hea Kil. We are speaking out against what scholars have concluded is genocide, yet scholars are being silenced. And there is a growing list of banned scholars who are being rejected by the system, including renowned doctor, author, and professor of medicine at UCSF, Dr. Rupa Marya, who was fired in retaliation of her call for the end to the bombing of hospitals. All of these silencing efforts send a chilling message to all faculty and students who might speak out against genocidal crimes, but are choosing not to in order to save their careers, their healthcare insurance, and their livelihoods. This is truly a historic and horrific moment, and we must stay the course. We must continue to organize, boycott, block arms shipments, strike, stand up and speak out against these genocidal atrocities and societal catastrophes. Please welcome our first speaker today, Dr. Sang Hea Kil.
My name is Sang Hea Kil, and I'm a professor in justice studies at San Jose State University, and I'm currently job suspended for supporting my students fighting a genocide, so I'm not speaking in as an employee of San Jose State University today. I'm here today to speak as the co-chair of the steering committee for the California Scholars for Academic Freedom, a group of over 200 scholars from campuses across California, and I'm here to condemn the unjust termination of Professor Rupa Marya that began with her job suspension in September 2024. My comments are based on a letter we wrote to UCSF Chancellor 5 months ago about her case. Let me be clear. UCSF will now be depriving its students, residents, and colleagues of the guidance of one of its renowned scholars and practitioners of internal medicine oriented toward health justice. UCSF's actions also threatens the health and lives of her patients. We believe that the hospital is now a more dangerous environment for marginalized people without her clinical care. Moreover, the move to suspend her clinical privileges at UCSF put her medical license in jeopardy under what might be seen as a false guise of protecting patient safety, given that she has no record of patient safety concerns in her 22-year career here at UCSF. The leaking of Dr. Marya's suspension to the press just hours after she was informed could be a violation of California labor law. And we feel this move was done to inflict damage to her reputation as a clinician who has served the most marginalized people in the Bay Area for decades. The potential consequences of these actions are dire for Dr. Marya at UCSF, and for Bay Area patients and for the profession as a whole. Indeed, UCSF may have already harmed all of the aforementioned constituents in the UCSF community, not the least Dr. Marya herself. The chilling effect of her firing will damage academic freedom and free speech on your campus and for all employees and even community members here on this campus. The basis of Dr. Marya's job suspension appears to be her outspoken and justified criticism of the near total annihilation of the medical infrastructure in Gaza, Palestine, and the targeted killings, maimings, and abductions of hundreds of healthcare workers while caring for a population undergoing an ongoing and intensifying genocide. She bravely denounced a call by certain Israeli doctors to bomb all Gazan hospitals, which the latter called quote-unquote terrorist nests. Her tweet about how her profession should handle a medical student on her campus who had likely served in the IDF was within the purview of her academic freedom to post, and she should in no way be punished for speaking out. As a mentor to students who take the Hippocratic Oath seriously enough to call into question whether UCSF should be training new doctors who have potentially participated in the genocide in their prior armed service, she was duty-bound to bring these concerns to the broader public. This silencing of the critics of Israel's genocide leads us to question whether UCSF can protect marginalized students, faculty, and staff from racist harm on this campus, or whether it's exercising due diligence to avoid complicity in this genocide. Dr. Marya's intramural as well as extramural speech must be protected, particularly given that its directed implications for her own academic area of research on health disparities and the treatment of underserved populations. She has every right to talk about these issues and their implications for the profession at this UCSF campus. California Scholars for Academic Freedom is concerned that UCSF's decision to fire Dr. Marya and suppress her academic freedom and speech rights might have more to do with pleasing major UCSF funders like the Diller Foundation and politicians who have attacked her like Scott Weiner, who's also closely aligned with the Diller family, is my understanding. So it is public knowledge that the Diller Foundation has funded slanderous websites like Canary Mission, for which Dr. Marya now has a page and for which I've had a page for several years, a situation which has led to repeated threats on her health and safety. The Canary Mission website is now being used by the Trump administration as a registry list for the revocation of student visas, and we expect more harm to come from this heinous website. And we are aware that politicians like Scott Weiner has successfully pressed the UC system as well as the CSU system to implement harder time, place, manner policies on campuses in order to repress further protest and speech about the genocide. UCSF is a public institution and should serve all Californians and not wholly or partially wealthy investors whose interests do not coincide with those of the vast majority of people of our state. Philanthropy that comes with strings attached has the potential to seriously degrade the reputation and quality of this institution. We strongly condemn the firing of Dr. Marya, the denial of her request for a hearing before her peers, and the capitulation of UCSF to donors, politicians, and a foreign government with APEC money in their unjust and immoral actions against her and her colleagues who have been fired for resisting UCSF's complicity in supporting a genocide. Please mark my words. UCSF will go down on the wrong side of history because of their treatment of Dr. Rupa Marya. Thank you so much.
Well, my name is Bisma Joffer, and I'm a civil rights attorney at CARE SFBA. And as a Bay Area native and an alum of San Jose State and UC Law SF, I was raised to believe that here we are progressive, that our rights are safe, and that we are not afraid to advocate for the rights of all marginalized people. But with my time as a civil rights attorney, I see now that it is not our reality. We have been inundated with Muslims and non-Muslims alike being targeted, terminated, and harassed for their advocacy for a safe Palestine. Dr. Rupa, like CARE's clients and so many others, are well within their constitutionally protected rights with their advocacy actions. These university officials are acting outside of the law while lining their pockets with the tuition of our future attorneys, professors, and activists. To create the safety, the rights, and progression we so desperately want to believe we have, we need to speak up against the violations of our rights for Dr. Rupa, for you and me, and for Palestine. Thank you.
To the few and the brave, the few and the courageous who are here today. My name is Dr. Rupa Marya.
Love you, Rupa.
And I've been fired. I came to UCSF 24 years ago and have served my community with dedication and with love. I have always been a doctor who speaks up for the health of all people. I have spoken up countless times as our community members have faced harm inside and outside these hospital walls. Throughout my career here, UCSF has harassed and intimidated me multiple times for my advocacy. But what they have done now is a shocking betrayal of the institution's mission and sets a dangerous precedent in medicine. Advocating for the right to health is my passion and my practice. Every patient under my care has always known they have the best advocate that they can get. And advocacy requires a free and unrestricted voice, because when doctors are silenced, people die. I am a scholar who studies health, the health impact of power. I study how certain structures create health for some people and create illness for others. In the US, who gets to be healthy and who gets to be sick is determined by power. Power cuts across every other determinant of health: race, socioeconomic status, immigration status, and gender. Those with power have more health than those who do not have power. and people who are marginalized will find health impossible if we are not allowed to speak up when they are being harmed. So it is critical that we understand and study the distribution of power. And this situation here, where I have been fired for speaking out against what countless experts have determined is a genocide in Gaza, is a remarkable demonstration of the abuse of power. My firing was motivated by people with tremendous power, billionaires here in the Bay Area whose real estate business puts working people on the streets. We must liberate our public institutions from these billionaires. Our public schools belong to the people. I am being attacked because I am a woman, because I am a woman of color, because I'm a woman of color with a voice. And I use that voice to say, stop bombing hospitals. When I saw the Israeli military bombing hospitals and abducting, torturing, and killing healthcare workers in Gaza, like Dr. Adnan Al-Bursh, professor of orthopedic surgery, I could not stay silent. And my speaking up led UCSF to attack me. UCSF has harassed, intimidated, suspended, and fired dozens of faculty, students, and staff in wide-scale violation of our constitutional and civil rights. And we must ask, whose health does UCSF stand for if it will not allow us to speak up for the health of Palestinian people as they face genocide? What kind of doctor does not speak up when any child is burned alive in their hospital bed? Our hearts have been broken by Israel's US-backed genocide in Gaza, and we have been robbed in the process. Instead of our tax dollars going to healthcare here, the wealth we generate through our work is going to destroy healthcare and commit war crimes there. But this story about my firing and our lawsuits to fight back is actually not about me. It is about the genocide in Gaza and how our collective voice as healthcare workers is being silenced by precisely the same forces committing the genocide. The silencing of healthcare workers across the West has been an instrument in enabling this genocide, which has destroyed Gaza's healthcare infrastructure and targeted and killed over 1,400 healthcare workers. They kill us there and they silence us here. This accelerates the annihilation of the Palestinian people. There are few left to care for them there, and there are few left to speak for them here. This is how my silencing and the silencing of healthcare workers enables genocide. And the enabling of genocide is against our legal commitments to uphold the Geneva Conventions. It is also against the very tenets of our profession, which mandate that we speak up for the health of all people. When doctors are silenced, people die. We must be courageous and we must speak. If UCSF wants to fire me for saying stop bombing hospitals, then they cannot claim that this is a place where medicine is actually practiced. If a job requires me to stay quiet as children are killed, this is not a job worth having. We have an obligation to speak up, now more than ever. We must not be silenced when our words and actions together can resist the erasure of the people of Palestine. To deny healthcare workers our right to speak is to deny our very humanity, as Israel and the US grotesquely deny Palestinians theirs. When institutions slide towards authoritarianism, we must fight to build ones that can be resilient and strong enough to work for all people. I am committed to the health for all, and that requires that we fight for our collective voice as healthcare workers, and we struggle for the very heart of our profession. Thank you.
My name is Abby Kaplan. I am Jewish, and I am a physician and a poet in San Francisco. And I did my fellowship in allergy immunology here at UCSF after my pediatric residency. I am speaking out forcefully on behalf of Dr. Rupa Marya, whose incredible work I have admired both at UCSF and in the larger medical community, promoting a vision of kindness and social justice for our broken, hierarchical healthcare system. And I, like many of you, am outraged by the genocide occurring in Gaza and our government's complicity. Israel has always said it has the most moral army in the world. But I can't find anything moral, or Jewish for that matter, about firebombing people who have been reduced to living in tents, burning them alive, shooting kids in the head, crushing people in their homes, murdering medical workers and journalists, and starving thousands and thousands of children, many of whom are suffering from kwashiorkor and marasmus with mounting deaths. Frankly, UCSF should be outraged by this as well, and instead it muzzles those who speak against it, like Dr. Marya. Among her many projects, Dr. Marya worked to offer a coming together of Jewish and Palestinian healthcare providers at UCSF. For this, she was vilified by the UCSF administration and accused of anti-Semitism, which conflates anti-Zionism with anti-Semitism, leading to her suspension and now firing from the UCSF faculty. A situation that's unacceptable and beyond outrageous. I call you in joining for the reinstatement of Dr. Marya, effective immediately.
Yes.
So last year, I was alarmed by Dr. Marya's situation and wrote a poem after Martin Niemöller's famous post-Holocaust poem. First they came for the anti-genocide campus activists, and I did not speak out because I was not an anti-genocide campus activist. Then they came for the migrants, and I did not speak out because I was not a migrant. They came for queer and trans people, and I did not speak out because I was not queer or trans. When they came for the Native Americans, I was not surprised because they always came for the Native Americans. And when they targeted Black Americans, I was not surprised because Black Americans are always targeted. When they came for the doctors, the teachers, the judges, the journalists, and those who did not bow down, I did not know how I could help them, what I could say. And when they came for the women, I forgot how to speak. When they came for the Jews, I was not surprised, and there was no one left to help me. Thank you.
Hi, my name is Annayia Butler. I am 19 years old and organized with Youth vs. Apocalypse, a Bay Area-based youth-led group fighting for climate and environmental justice through centering the intersections of race and class. I am here today on behalf of YBA to condemn the unjust termination of Dr. Rupa and will share comments on a letter we wrote to UCSF Chancellor in the beginning of the year about her case. Why are healthcare students and professionals being threatened and fired? Simply because these people understand and possess the medical facts that clearly dispute, disprove, and challenge the common narratives of lies that are manufactured to downplay the genocide that is happening right now in Palestine. These students and professionals threaten the legitimacy of the propaganda and lack of media coverage that refuses to reflect the true scale of violence occurring in Palestine. Doctors take an oath to never do harm, but is it not harmful to continue to normalize and uphold systems of genocide that we in America have a direct hand in funding and sustaining? Dr. Rupa embodies this responsibility as she is one of the few medical practitioners in America who centers an analysis of power and its influence on the health outcomes of marginalized communities. Western medicine has a long history of discriminating and perpetuating harm against oppressed people, so this analysis is essential for providing adequate care to communities following these lineages of violent medical injustice. When educators and healthcare professionals like Dr. Rupa are prohibited from practicing, people from marginalized communities are left even more vulnerable to the systems of suffering the systems of white supremacy, racism, disposability embedded in our spaces of education and care. It is clear that UCSF is not here to protect our communities or students, but to serve and please the interests of funders who fund platforms that dox brave voices like Dr. Rupa. As a public university, UCSF must serve the needs and visions of the community it serves. Community needs Dr. Rupa. As someone starting college this upcoming fall to study the intersections of public health and political science, it is extremely frightening to see medical professionals like Dr. Rupa fired for practicing their principles and expressing basic humanity, something I am committed to do for the rest of my life. What is the future of spaces of education and care if people aren't allowed to speak out against the most violent and inhumane crimes against people, children, and our environment? What world and culture are we leaving to our kids? While Dr. Rupa's termination is extremely unlawful, unjust, and a tactic to impose fear amongst those willing to speak out against genocide, her resilience is a testament to the steadfastness of the movement as a whole. In a trying time such as today, where our humanity is being challenged, we must remain principled. We must not be silent. We must be ready to sacrifice, like Dr. Rupa. And now more than ever, we must stand in solidarity with each other. Free Palestine.
Free Palestine!
Everyone, sorry for my dog barking. That's Lucky from Korea. I'm Cynthia Papermaster, Code Pink, San Francisco Bay Area. We're here to support Dr. Rupa, who's been unfairly targeted and punished for her views on what we are all very concerned about, everyone here, which is the genocide happening in Gaza that's being funded with U.S. tax dollars, and Israel is carrying out as a partner to the United States. And the reason I say partner is because we're not stopping it. We haven't even tried to stop it. And that's the United States' position. Whether it's a Democrat in the White House, or a Republican in the White House, or a Republican Congress, or a Democratic Congress, they are voting for billions of dollars of our taxpayer money to go to lethal weapons like 2,000-pound bombs, Hellfire missiles, which cut up the victim. They slice the victim up. And that is profiting Lockheed Martin, Boeing, Grumman, Raytheon, now RTX, General Dynamics, and I could go on and on. These war profiteers are what are actually driving this. It's not about, honestly, it's not about, I'm sorry, I'm having a hard time. I'm on day 15 of a hunger strike for Gaza. I mean, a fast for Gaza. Thank you. Only eating 250 calories a day, which is what the Israeli allow the people of Gaza to have before they blocked all food from coming in. So I'm not sure if I'm making a lot of sense, but I do want to say this, that Code Pink is 100% with Dr. Rupa. We will do anything to support her. She is someone we love, and we're going to go on loving and supporting, and to make sure that no one is targeted for their views on the genocide. Everyone in the world is against this genocide except the war profiteers, the pro-Israel lobby, and the horrible right-wing Christian Zionists and Israeli Zionists, and that's what's really going on. Thank you very much for having me.
I'm Elizabeth Milos. I'm a member of UPTI, University of Professional and Technical Employees. I've been a medical interpreter here since 2007. I'm speaking here as UPTI Members for Palestine. And also, I want to let people know that we are also part of a national network of Labor for Palestine, which is Labor for Palestine National Network of more than 40 unions and organizations that have been fighting for Palestine for a very long time. But I'm speaking here as UPTI Members for Palestine. I want to let you know that on April 11th, I was called in by my supervisors to let me know that I couldn't wear my keffiyeh at UCSF while working, and wearing it could lead to my termination over, well, nothing in the dress code prohibits wearing a keffiyeh at all. I was called in before that to an investigatory meeting where they let me know that talking with my coworkers was prohibited as well. Specifically, I couldn't, quote, access patient care areas to talk about non-work related issues even during my breaks. If that's not a violation of labor law, what is? People don't seem to realize that this well-known saying in the labor rights struggle, an injury to one really is an injury to all. my union filed a free speech unfair labor practice after UC imposed these draconian measures about time, place, manner rules that don't belong in the university system where the free speech fight started. Now more than ever, we need every single one of us from our own unions to protect free speech for all workers here at UC and in other California systems. Yes. California State University has also been attacking professors there, like Dr. Rabab al-Duhabi. In fact, UPTI members for Palestine and many CW members will be taking up the issue of Palestine in our own convention, CWA convention, in August 11th and 12th in Pittsburgh, Pennsylvania. I'm running for delegate, as well as other members of UPTI members of Palestine are running for delegate for that convention. However, our union reduced the number of delegates to only 4 allotted. All of our union's bureaucracies have been reluctant to support our members who speak up for Palestine because of its long-standing complicity with Israel's occupation of Palestine since the 1920s. This has been pretty well documented, and most recently in Jeff Schirker's book, Labor Imperialism. Palestine, UPTI members for Palestine is part of a larger group network, the Labor for Palestine National Network, which has 40 unions and organizations. And we're supporting the call that the General Federation of Palestinian Trade Unions have made and asked of US labor. This specific call has to do with stop supporting apartheid, stop arming Israel, and break ties with Histadrut, the supremacist apartheid trade association that is financing the IDF out of the paychecks of every worker in Israel. The level of complicity is frightening. We need a united front of scholars, faculty, students, and workers to not only stop this genocide, but to create a just future for all, which includes Palestinians. Yay! Includes Palestine and Palestinians. Today, another hospital was bombed in Gaza, killing 42 people. From the first day, on October 8th, Israeli doctors sent out a notice and asked the Israeli government to bomb the hospitals in Gaza. How on earth could UC be supporting a government that supports bombing hospitals? Thank you.
Thank you all so much for coming. Free Palestine.